Hi, everyone. I am Rachel, your host and community manager here at Alloy Health. For those who might be new, Alloy is a digital health platform bringing evidence-based menopause hormonal solutions direct to your door. Our mission is simple: to make sure that women get the care they deserve during perimenopause, menopause, and beyond. I am thrilled today to welcome Dr. Aleksandra Brown, a board-certified dermatologist with more than 15 years of experience in medical, surgical, cosmetic, and pediatric dermatology. She's a partner at River Ridge Dermatology, where she focuses on caring for teens and women with an emphasis on healthy skin and healthy aging. She's also passionate about education, sharing expert insights with patients in her clinic, as well as with thousands of women on Instagram, TikTok, and YouTube. Since it's Perimenopause Awareness Month, it feels especially important to talk about how our skin changes during these years and how we can care for our largest organ before we even realize we're in perimenopause, as well as once we're navigating those changes more directly. Before we dive in, I want to, as I always do, invite everyone to drop their questions for Dr. Brown into the chat. I will facilitate those a little later. And because we always want these conversations to feel supportive, if you're ready for next steps, we'd love for you to take advantage of today's discount code, which you saw on the banner before we began, Brown20, as a little help along the way. Dr. Brown, welcome. We're so happy to have you here to help us unpack what's happening to our skin pre-perimenopause and through to the end of menopause. Welcome.
Hi, Rachel. Thank you so much for having me. Yeah, I'm so glad to be here. I can't wait to share all this stuff.
Great, great, great. I know you're a terrific educator, keeping things clear and concise and actionable. So let's start with the foundation. So many women say their skincare routines just stop working in their 30s, their 40s, and beyond. What's really happening to our skin during perimenopause and menopause?
Right? You set your routine in your 20s and you're doing it and it's all great. And you hit like mid 30s, definitely 40s. You're like, it's not working. What am I doing wrong? And you're really not doing anything wrong. Turns out we start losing estrogen. And as estrogen levels decline, your skin thins out. It becomes thinner, drier. So things that and slower to repair. So products you've been using, especially like harsh retinols, can cause more irritation. And instead of getting like that glow that you were getting from your retinol in your 20s, you end up with like irritation and redness. And you really have to step back and assess, what does your skin really need? You can't just maintain that routine throughout the decades. It completely changes.
It completely changes. I can tell you firsthand that I used Retin-A as a teenager. I think I started at 15 and my skin was fabulous. And then into my late 30s, it was a whole different game. And I had to sort of relearn what was what and what was sort of not just safe, but effective for my skin. So can you talk a bit more, just sort of pull that thread for us about hormone stress, sun damage, and even smoking, and how those things come together to accelerate the changes we see in midlife?
Funny you mentioned smoking. I just did a video that's actually coming. It's not ready yet. It's being edited on my Instagram, but it addresses the three signs, and that's like how your hormones decline, smoking, and aging. And aging plays a biggest role. I mean, we all know that. You see, they took identical twins, and one wore sunscreen, one didn't, and what they look like. But smoking really, I mean, nicotine is an inflammatory marker. It slows down wounds, impairs the skin barrier, and then you add hormonal decline to that. This study actually showed that hormonal replacement helped skin too, but nothing like sunscreen in your 20s was really like it's really going to reverse age, if you will. If there's something as a time machine, that would be go back and put that sunscreen on in your 20s. So hormones make a really big role because your skin isn't what it used to be. It's dry, it's sensitive. Combine that with, in your 30s and 40s, you have elderly who need help, your parents, and then you have kids who are busy, so you're really stressed out. Maybe you're
Yeah.
not sleeping well, so stress is adding to it. And if you combine that with not adding sunscreen and then smoking,
Yeah.
it's like a perfect storm of about to head south. And then you've continued just thinking from your 20s, so something's got to change.
Yeah. Yeah. Thank you for that. Dr. Brown, what is the sort of sweet spot between keeping skin calm and hydrated while still using ingredients that really move the needle for us?
So that's a really important thing, especially in your 40s. You want to continue your tretinoin or retinol, But if you don't if you don't start doing like hydrating ingredients like ceramides and niacinamide, maybe some hyaluronic acid, the tretinoin is just going to continue to irritate and you can't repair that barrier. So you just create irritation. So you want gentle exfoliators. You still want retinol. Maybe instead of tretinoin, get to like over-the-counter retinol, but introduce it in addition to like hyaluronic acid, niacinamide, things that have like glycerin and squalene that will soothe the barrier so that you can tolerate those actives. You can't just go straight to actives. Layering smartly.
Okay. Okay. So hit on that for us. Layering smartly. That sounds like something we really need to know.
So, when you're 15, you start your retina, you just take that retina, you put on your face. Okay. You hit 30, you're like, okay, I only need a pea size amount.
Right.
Maybe I should moisturize underneath. So my patients who come in their 40s and they're like, I've never done anything. That's okay. You're not behind, but you need to make sure that barrier is repaired and always layer your skincare thin to thick. So I say, get like a lightweight serum, like a hyaluronic acid serum or something, apply that on your skin first, let that dry, then do your retinol or your tretinoin. Because if you go straight to retinol, tretinoin, that's just too much. So
Yeah.
layering smart and knowing that, like I just did a video on niacinamide that's coming to YouTube in 2 weeks. 10% niacinamide is just not everyone's jam, 2% maybe. So knowing what it is that you're applying and what is it doing, make sure that it doesn't irritate you. Just because it's popular on Instagram or TikTok doesn't mean it's for you. So you have
Yeah.
to know your skin and know what ingredients to look for. But you can't go wrong with like a gentle moisturizer first at night to just kind of repair that barrier and then do your actives in a layer thin to thick, no more than 3 to 4 steps at a time.
Okay. I'm so glad you said that. I just want to hover here just for a minute because we do hear a lot about how to apply products. And I know we'll probably touch on this again with M4 in particular, but we're going to cleanse. If we're still using a retinol product at all, we're going to moisturize first. Where do serums come into play?
So serums are typically lighter than retinol. So serum is something, it's a name for a texture. It's really lightweight, so you want to apply your serum first. And this would be a good time to apply hydrating serum, like PDRN, the same as perm is all the rage right now. So now I'm using hyaluronic acid serum, something hydrating, because serum is lighter than, well, your serum for the morning. M4 is really nice. I kind of like that on
Okay.
top of my other serum. Okay,
Okay.
it just, the word serum implies it's lightweight, so you just really want to go thin to thick. So I would do like a light hyaluronic acid serum and then maybe M4 cream with a tretinoin, or I use my M4 in place of moisturizer at night, so I end up doing tretinoin and then M4. Or if I'm not using tretinoin that night, I just go straight to my M4. So it
Okay.
just thin to thick. And
Thin
let
to
one
thick,
layer, one
always.
layer dry before we put the next one.
Okay. Thank you. All
But
right. Acne. What is happening with the acne? I would also say that someone, myself, being perimenopausal for years now, you are potentially dealing with hormonal acne then for years. And also if you could amplify black and brown skin and
mhm.
acne as well.
So many women come in at 4, they're like, I've never had acne. I'm like,
Yeah.
first off, I have no sympathy for you because I've had it my whole life and I still have it. Just kidding.
Really?
But why? And they're like, well, what am I doing wrong? Am I eating something wrong? I hate to, like, we can talk about nutrition. Nutrition does play a role, but it's not your fault. Like, you can't take your ovaries and be like, you need to make this much estrogen. It just ain't going to happen. So estrogen drops, so body perceives more of male-like hormones. So we have more progesterone and testosterone. Well, guess what happens when you have more of that? You get acne. And typically hormonal acne is like that cystic jawline. They're painful. I've got one healing right here. My kid says, you can't even see it. It's underneath
Yeah.
the jawline. It's in there. It's underneath. I
Really?
was very lucky that it's under the chin, not in the front. But like it happens. And you didn't do anything to cause it. It's just your body has more of those male hormones. I also see this on patient perfect example that go on specific IUDs or those implants that are progesterone only. Well, those are male like hormone. Progesterone is opposite of estrogen. So you break out with more cystic acne because you don't have enough estrogen. And for this, I love spironolactone. It's an oral prescription medication. I love it, but you still want to do your tretinoin and exfoliating acids. And when it comes to darker skin type, the key is, well, two things. One, tinted sunscreen. Okay. Darker skin tones tend to retain that pigment, the brown marks and pink marks, the post-inflammatory hyperpigmentation and post-inflammatory erythema that we get after acne. The darker the skin, the longer that sticks around. So I'm like skin type 3 and olive Mediterranean. that thing will be there for about 4 months. Like I already
Right,
know it. I just
right.
know it despite my exfoliation and retinoids. So step one, prevent breakouts. Step two, tinted sunscreen. Tinted sunscreen helps with pigment. Darker skin types tend to be more prone to melasma and retain pigment longer. So tinted sunscreen, especially mineral that has iron oxides, will do a better job at slowing down the pigmentation. And then gentle exfoliating acids. So in your retinol, adding in like lactic or glycolic to help increase that cell turnover to fade the pigment faster. That's good for all skin types, but for darker skin types, you want to make sure that exfoliating acid's not too harsh, because if you dry out the skin too much, then you're going backwards, causing more pigmentation. So very tricky and very important to be gentle with darker complexion.
Great. So glad I asked. Crepey skin on the face, the neck, the chest, the thighs, the knees, the arms. What can we do about crepey skin?
So two things. One, it happens because, I mean, you're losing estrogen and the skin is drying out and the barrier is impaired. So simple things like hydration. A good moisturizer within an hour will look better, period. It didn't fix anything. It's appearance thing. But something that will fix are things like body retinols. So, there's so many brands out there that specifically have it formulated. If you're low CD like me, the 2 nights when you switch out your estrogen patch, you might put some actual retinol in those areas. So for the areas that I see that women age in, and this is coming from seeing patients and like for 15 years. My family doesn't talk about this. I grew up in Southern Europe. We just don't talk about aging. We just don't care. But my
Okay.
patients are teaching me this. So, face, we all know it, jowls, but things like neck, hands, knees, skin, like on the arms right here. I mean, women come in and it really bothers them. And it took me, I just turned 44 a couple weeks ago, and I kid you not, 44, there's a study that says at 44, like you're aging, the 44 years, like even faster.
Right.
That's all true in my experience. So there's body retinol going everywhere. So moisturize, retinol, and then add glycolic acid or something to exfoliate once a week or so. You can totally layer like your exfoliating acid, which are usually toners, with a good moisturizer on top, or you can just do a body retinol. You can alternate those two combinations.
Terrific. Collagen loss. What does it actually mean for face and body? Because
So call
sorry, I'm so sorry to interrupt. I was just thinking that, people sort of say collagen like doesn't do anything, collagen does do something, and then there's like consuming it, and then there's putting it on your face. And we know at least with M4, it's helpful, but what's your say?
definitely helpful with M4. And then what happens? Okay, let's talk about what happens. Collagen is 100% important because it thins out. We'll lose collagen type 1 and type 3. And the collagen is in that second layer of the skin, which is giving you support and structure. So that's why the skin doesn't bounce back. Like if you pinch, if I pinch my
Yeah.
kid, that skin bounces right back. If I
Yeah.
pinch me, it takes a hot minute. So it just thins out. Another thing that my patients over 50 notice is that tiny little scratch or a bump of a bug bite, your skin bruises. So the collagen, even in blood vessels, is weakened, causing easy bruising. The skin is thinned out, causing easy bruising. So trying to build up collagen with M4 and retinoids to help stimulate the collagen production, it doesn't happen overnight, but this is something that you are going to see better results if you start earlier. So you start in your 30s or 40s, you're going to see better results versus waiting till 70. Now, I have patients in 60s who start retinol and M4 for sure, and they do really well. But the sooner you start, the better the results. Oral collagen supplementation, though controversial, I think is pretty harmless. I take it, any brand. I personally like things that have third party testing. I'm looking for Verisol specific trademark collagen right now, orally third party tested. I'm going down that rabbit hole myself. I'll spare you that. But oral collagen is nice. I do think it may help hydration. Topical collagen, it's just too big to be absorbed to do much. Like if it's in a cream that comes with hyaluronic acid, it will definitely plump and hydrate, but it's not stimulating. We talked about immediate results and we talked about how you really fix it. It's more of like an immediate result. It will hydrate, it will give you somewhat plumper skin, but you want to do both. You also want to do things like M4 and your retinol and your oral collagen to help stimulate that collagen production long
Interesting.
term.
Super helpful. Does anything, Dr. Brown, anything help with dark circles?
A tough one.
I
So
know.
well, and it's tough because most of the time when patients come with dark circles, really honestly, they're like young in 20s and they're bothered by this. And 9 out of 10 patients who come in with dark circles will have family history or personal history of eczema, asthma, or allergies. So that means that those dark circles are from blood vessels underneath. Okay. So you can't really alter your genetics and change your parents, but you could use topical creams with like caffeine or something to help tighten those blood vessels. I also like things like M4 eye cream. I think it's really nice. It hydrates. I think that would be ideal for somebody 40 and up because you're looking to help stimulate collagen production and hydrate at the same time, or like eye creams with retinol to help thicken the skin. There are in-office procedures that can help with thickening the skin, like microneedling. And very few patients will come in and say, I have dark circles or, and it be true pigment. Most of the time, if you take that under eye skin and you stretch it, if you see a brown pigment, that's true pigment where we need like bleaching agents, retinoids, sunscreen. But if you stretch that skin out and you see blue underneath, those are blood vessels. And that's 9 out of 10 dark circles, if you will.
Huh, okay. Um, Dr. Brown, help us build a modest routine for skincare. I'm thinking like, and I know it changes, and we'll talk about that later, sort of what your picks would be for 30s, 40s, 50s, 60s, and on. But sort of a modest, general, effective routine, and then a luxury, effective routine.
Yep. So my patients will come in regardless of age, and they're like, I'm doing nothing. Where do I start? Okay. 3 things.
Okay.
Your face should be clean at night. Like if you're not washing at night, you got to wash at night. 2, you need retinol in the morning. I'm sorry, retinol in the evening. Retinol will help stimulate collagen production. It'll give you that glow skin. And the sooner you start, the better the results. And then 3, and this is probably the most important, sunscreen in the morning. Because you can't really go back in time and say, I wish I would have put sunscreen on in the 20s. You just can't. So if you just want to start with basics, I always say it's not about how much money you spend on it. It's about getting the right ingredient and staying consistent with it. So
Okay.
sunscreen, retinol, and cleaning your face are like the basics. Now patients will come and be like, well, I'm doing all that. Then I'll add vitamin C in the morning. Vitamin C is an antioxidant. It can help stimulate collagen production by protecting from UV damage. It can increase potency of your sunscreen like 8-fold.
Wow.
At nighttime, I love, love, love adding like fancy peptides, growth factors, and for my patients who are really much on a dry side and sensitive, but they want that collagen production. And I call that my bougie and my advanced. Like my patients who are already doing the retinol, but they need extra stuff at night. We're talking about, growth factors, M4, and we're talking about peptides.
Terrific. You talked about skin getting thinner. You've talked about retinol just now really being the gold standard, I think. Pull that thread for us about peptides. I know that I see in your feed, you talk about peptides a lot. You are a fan. Can you break down what they actually do and how they compare or work alongside other ingredients like the retinol or estriol?
Yeah. So peptides are so popular right now, and it's such a big term that people are like, do I need to be doing peptides? What does peptide even do? So I actually just recently, I think 2 weeks ago, did a YouTube video. So I have a full YouTube video on what peptides are and what they do. But briefly, they're these short chains of amino acids, and they act like messengers. So depending what type of peptide you have, it can signal to your skin to help repair barrier, to increase hydration. It can signal to calm down inflammation, or it can signal to stimulate collagen production. So just because something is a peptide doesn't mean it's going to do all 3 of those. So you really kind of have to know it. And I break it down in my YouTube video, like which category does what and which peptides do what, and give a couple of examples in each category. So in general, peptides that help hydrate tend to be on a more affordable side, and everyone needs them. Like everyone needs them. And then there are some that help stimulate collagen production that are, really selected. They tend to be a little bit pricier. And then there's others that tend to like mimic Botox in a bottle that help minimize movement lines and dynamic lines. And there is no such a thing as Botox in a bottle. But if you're somebody who's doing Botox and you want to prolong your effects, those are really nice. The trademark for that is ergosterol, so it's in a lot of products. Or if you're somebody who wants to avoid Botox, but you want that would be the one to add. So it really just depends on what are you trying to accomplish with your peptide. You have to pick the right one to do that purpose.
Okay, super helpful, Dr. Brown. All right, you mentioned the importance of SPF every day, every morning. I kind of just want you to like Say it one more time. And also for women with darker skin, who may or may not realize that we too need to be using an SPF.
Darker skin specifically needs to be using an SPF starting like whenever your melasma flares. So my besties are both much darker than I am, and they can look at sun of their melasma flares. So for that, I am lighter skin. I mean, well, I'm skin type 3 olivey, and I wear tinted sunscreen every day. Like right now, I just have tinted. But sometimes in the summer, I'll even layer. So I'll do regular chemical sunscreen with like a tinted mineral on top. People would argue that you should never mix your sunscreens, but I think it's fine to layer them. If you put one on and it dries, you can put the second one on. So I think everyone in their 20s, well, actually even teens, I'm trying to get my 13-year-old now to do it every morning. And boy, is it a struggle to get her to remember. She wants to, she has every intention, but for her to actually do it
I
is
know,
a different
remembering
story.
the different thing.
So if you can get your kids really to start, like I'm assuming a lot of people listening are my age, like get your teen to start now and teach them to do their neck as well. Like they won't like you now, but they don't like you now anyways. Like they'll thank you in 20 years. So
Yeah.
start sunscreen now. But if you're like me or a darker skin type and you have melasma and you just want to do everything you possibly can, not only is it important to have that SPF, I personally think it's important to have tinted SPF every single morning, like every single morning. Now, if
And
I'm
why
just
the tinted? Why specifically tinted?
So tinted has iron oxides, and iron oxides block the pigment that can be formed even from visible light. So like I'm sitting next to my window right now and visible light UVA is coming through, and I can't get tan on the other side of the window because UVB is blocked, but I'm certainly aging and getting wrinkles and
Wow.
getting pigment. So tinted SPF.
Dr. Brown, you brought up melasma. That was my next question. Can you unpack what it is, the importance of sunscreen specifically, when it shows up, why it shows up, all of that?
As somebody who suffers with melasma, you wouldn't think it because I do a lot to keep it controlled. This is one of the topics that I'm very, very passionate about. I end up with a lot of patients, and I'm going to direct everyone to my YouTube channel, Melasma video, and then on Instagram and TikTok, I did like short ones as well. But I always say start with like step one is tinted sunscreen. I feel like I'm bragging on this.
No, I love it. I love
But
it. Keep hammering.
step one, like you just like trust me on it. It's such a simple thing. It's simple and it's inexpensive. Okay. Step two, I love adding retinols and exfoliating acids at night. And that's very specific on the skin type. So my 30-some-year-olds can do stronger things. My 50-some-year-olds, I have to back down a little bit and be mindful of adding some hydrating agents to keep that barrier intact. And then once the topicals aren't really working, the over the counter, which happens for some, but I'd say maybe 30% of the patients, I would assume. I'm a little biased because I see the ones that don't work over the counter. You know, if nothing's worked, they come to me. So I see them a lot, but I'm guessing 30% of the time it just works. It just works itself out. You're doing vitamin C in the morning, you're doing tinted sunscreen in the morning, you're doing retinol and exfoliating acid and alternating those two at night. But if you give that 3 months and it takes that long, pigment can take 3 to 6 months to see improvement, and you've done it every day, it's not better, then come see a dermatologist. So I'm going to talk about prescription medications like hydroquinone. We're going to talk about oral tranexamic acid, and that stuff works so good.
Wow.
And the biggest misconception, if you're a good candidate, and I discussed that in my video, who's a candidate, who's not, but the biggest misconception is that I don't have to wear my sunscreen. I'm only going to be out there for like 15 minutes, even though it's 1 p.m. And I'll just do a laser. My melasma is going to go away. It's not going to. Okay, lasers produce a lot of heat. You have to be very careful which laser you do and what settings you use. And even then, it takes multiple. And even then, it takes still all that skincare we just talked about. So why not just
Wow.
start there? You know, I
Yes.
always say lasers are your investment. Your skincare protects your investment. You got to do both. You can't just throw money on laser and not do anything at home. So it is so important to manage expectations when treating melasma and for patients to understand they have to stay consistent and give it time.
Does we know, well, correct me if I'm wrong, but hormones impact melasma, does stress or other lifestyle factors, certainly not wearing sunscreen, but is there anything else that we should be aware of? So many women
Stress,
stress.
yeah, stress can, hormones can. So pregnancies and birth
Yeah.
control.
Yeah.
I have some patients who are doing so well and they had to go on birth control for other medical reasons, and boy, did it flare. And some are very disturbed. One lady just flat out stopped her birth control and she's like, I need the tranexamic acid because they're contraindicated. They can't be taken together. It was really bothering her. So, and some people might not be bothered by it, but I only see the ones who are just like devastated by their melasma. It's
Okay.
really rewarding when it like you give them something, it really works. It's so cool.
Oh, I can imagine. I can imagine. Um, Dr. Brown, you have talked a lot about estriol and specifically that you are a fan of Alloy's M4. What makes estriol and specifically this product special, and how does it support things like firmness, elasticity, and hydration?
Estriol is really cool because you will, as you guys have recently been posting and I've been reading about, you don't have to worry about systemic effects of estrogen.
Right.
Okay. So, and it's not even estradiol because estradiol is that vaginal cream. And I'll tell you, I have M4, I have another compound locally, and I have the vaginal estrogen just to try them all. They have all made it on my hands. One has not made it on my face yet. I can't get myself to do it. I know it's just a thing, but um, and there's because this is something that I've been wanting to do for my YouTube channel to compare all three, and I haven't filmed that yet. It's coming because I like to use it for a little bit. But there's something about the M4, the way it's dispensed and the way it goes on, both the cream and the serum. And I kind of like the serum in the morning. I like the cream at night. We already know that the data is there that estriol will help stimulate collagen production, that will help hydrate. So it's addressing we talked about you want active ingredients and you want your hydrating. This is one of the things that's going to give you both. It will replenish the hydration barrier and it will help stimulate collagen production. So in the M4, you're getting both of those effects in a very nice, I really like the dispenser, I like the pump. It goes on really nice. It doesn't irritate the skin at all. It feels hydrating. It layers beautifully. I'm wearing the serum underneath my tinted sunscreen right now. And my tinted sunscreen's a tough one. It's like a fluid one. So if you put something too thick underneath, it's just going to roll off and it doesn't roll off. So it's really nice how it layers. And I know women use their vaginal estrogen cream on their face. And for my patients who are like, oh, I have a bunch, my guy told me that's fine. But I'm here to tell you that the consistency is completely different. It's like toothpaste and a nice fine, I don't even know what to compare to, but like the vaginal estrogen cream comes out of the tube like thick toothpaste, and then you're like rubbing it on and it's like stretching your skin versus the M4 just like goes on.
Yeah.
And
It's
it feels like a really elegant, yes, it
yeah,
feels like a Cadillac. It
yeah.
just feels nice. It really
So funny,
does.
Dr. Brown. I love that. Thank you for that. I appreciate that. I'm looking at questions. I'm going to get to them in just a minute. Um, you talked about consistency sort of being like the most important thing versus chasing trends. Um, can you talk more about that and like what consistency looks like over time as our skin is changing over time?
Yeah. So you want to really listen to your skin. In your 20s, your consistency might be just put your sunscreen on in the morning and wash your face at night. In your 30s, the consistency is really like, okay, you've washed your face in the morning, you should apply your vitamin C and then your sunscreen. And you should do that every single morning, just like you brush your teeth in the morning. And at nighttime, you should do your retinol. And whether you pick a retinol that's over the counter that you use every night, or you do prescription retinol and then you do 3 nights a week, but you've got to stick with it. Okay. In your 40s, I'm in my 40s, I'm adding M4, I've added peptides, because peptides will help hydrate, they'll help some of those movement lines. M4 will help stimulate collagen production, but you didn't like drop your retinol to use your M4. You're using both. You're either layering them or you're alternating them. So
Okay.
it's almost like in each decade, you're like adding one while staying consistent with the others.
Okay. Got it. So it's additions. It's additions that make sense given what you're seeing, what you're feeling, what you're experiencing in the mirror over time.
100%.
Okay.
And people love to break it down by decades. And I mean, I guess I get it. So I've made a video like skincare in your 30s, skincare in your 40s, skincare in your
Great.
50s and up. And I would love for people to check that out. And honestly, I don't mention M4 or estriol of any kind until 50s. But at 44, I'm going to have to remake that video, skincare in your 40s, because I'm already adding it. Like, if we're going to be honest,
Okay.
And I have been using it for a couple of months, but I made the video, what, 6 months ago.
Right.
So, you know, in 40s, I add exfoliating acids. The video of skincare in your 50s really starts with like pricey things. So if a 50-year-old shows up and they're like, I'm not doing anything, I don't tell them to go watch that. I'm like, go watch skincare in your 30s. Like, I don't care if you're 50 and you're just starting, that's okay. We're going to start with the basics. So it should
Okay.
be like, it should almost be like level 1, 2, 3, not like decades
30s,
and
40s,
ages.
50s.
But yeah, but people just really be like, oh, at my age, what should I be doing? Well, it depends. What have you done so far? Like, what are your goals? It's really individualized.
I appreciate that reframing. That actually was one of my questions later, sort of how do we look at skin in our 30s, 40s, 50s? I take no offense, Dr. Brown. I appreciate being educated more than anything. Is there anything you talk about sort of like adding things to the pool? Is there anything we should be eliminating over time?
You should, I don't see a point in beef tallow. I'm just kidding.
Okay.
Food does not belong on your face.
Okay. Let's talk about that.
I just see the trends that I'm like, really?
Mhm.
Really? Like, you're going to put coffee grounds on your face for what purpose?
I
If you want
haven't.
caffeine, there's a cream with caffeine in it. Like, you're really not getting that amount of caffeine. If you want to exfoliate, pick a gentle exfoliator. I really think the skincare is formulated. There's so much that goes behind it, you know, stability testing, efficacy, clinical studies,
Yeah.
data. And
Yeah.
you really think you can do the same thing in your kitchen, mixing it together? I don't,
You
not a
can't.
fan. So I just don't think, and I grew up in Southern Europe. Uh, Food is supposed to be on your face according to, but no, no,
No, you're not a
no,
fan. Okay.
I agree that. I think I made one video on April 1st about putting yogurt in my face and it was April Fool's joke. 100%. It was, I did.
Brown, you're much funnier than I took you for. I'm really enjoying this conversation. Okay, I'm going to turn to questions that have come into the chat. The first one is, does spironolactone negate the benefits of testosterone supplementation?
This is me off script. Great. Kidding. It does, you know, you bring up a good point. And this is a question I've been discussing with a family member who's doing both right now. And
Okay.
I don't think so, but also run into personally things like 10 years ago, I was much younger and not really understanding of menopause and things. And I had a patient who was older and she was on testosterone and doing all these pellets and supplements and she was losing hair.
Yeah.
Well, testosterone supplementation can cause hair loss. So she was getting hormonal acne. So she was seeing me for spironolactone and we were treating hormonal acne and hair loss. And I don't have a filter, I probably should, but I said, you know that what you're doing with testosterone is doing this. And she was not very happy with me. But recently another patient came in and said the same thing. And I did the same. I said the same thing. I'm like, what you're doing is causing you hair loss and hormonal acne. So I'm prescribing testosterone to balance those two out. I'm sorry, I'm prescribing spironolactone. I don't think me prescribing spironolactone is negating your testosterone effects at all. Because I understand, I don't know this personally, but I understand that a lot of women are doing testosterone 40s, 50s, and up to get energy and mood and things like that. Maybe I'll get there someday. I'm not there yet, but I'm too attached to my hair for it to thin out and it's
Yeah.
already thinning out. So
Yeah.
it's got to be balanced. But if you like the effects of testosterone and you're seeing side effects, in my experience, adding spironolactone has not minimized those effects or blood work of spironolactone. That's just of testosterone. That's just been my experience.
I appreciate that candid answer. And I think ultimately too, sort of hearing from um, a prescriber who really understands specifically testosterone is super important, along with your dermatologist who may be prescribing spironolactone. I love this next question because it's one of these like one and done things, and it's important to know what's true and what we really should be doing. Is foundation with SPF the same as tinted moisturizer? And I would ask, is it also the same as putting on an SPF? That looks like a no. That looks like a hard no answer.
I'm going to direct you to my YouTube video where I apply, actually, it's on my Instagram. I literally apply the recommended amount, which is a quarter of a teaspoon. There's a quarter of a teaspoon in my bathroom always. Okay, I'm not cooking in the bathroom. I measure the sunscreen, tinted sunscreen, and I apply it, and I look like a normal person would. Then I measure the same amount of my It Cosmetic CC cream, and I apply it, and I look like a clown. I
Okay.
don't see anyone out there walking around looking like a clown when they wear their makeup. Nobody
Mm,
does.
mm.
So if you truly have, and please let me know if you know what that makeup is, okay, that doesn't crease and you can put quarter on your face and neck and it doesn't look like a clown, go on my Instagram and tell me I was wrong. But you cannot possibly apply enough. So when I hear I only wear sunscreen when I go outside, my response is, oh, so you wore it this morning? Like, well, no, I was just coming here, but you went outside.
Okay.
Or, well, it's in my makeup. I'm like, well, you wear makeup every day and you apply the proper amount. Well, no, well, then you don't. So
Okay.
sunscreen should go every morning underneath your makeup, period, non-negotiable. Okay? And if you really want to prove me wrong, get you a quarter of a teaspoon from your kitchen, measure out your makeup in there, apply it to your face and neck. And if you look good, by all means, more power to you.
Okay. Thank you for that. Dr. Brown, can you recommend products without fragrance and chemicals? I have extremely sensitive skin.
The word chemicals
Mm.
makes my skin crawl a wee bit
Okay.
because
Got it.
here's my water. It's a chemical.
Mm.
Okay. The air we breathe is a chemical. So when I hear chemicals, that's implying that there's something bad in skincare. And okay, so CeraVe, Cetaphil, I love the brands, but people will say, well, it's full of chemicals. Well, what do you mean? Like, what chemical are you trying to avoid? What exactly are you trying to get out of? So then they'll attack parabens, then they'll attack preservatives. Well, everything has a preservative. And I really think that we eat more chemicals in a hot dog. If you've ever eaten a hot dog, you've probably eaten more toxic chemicals in a hot dog than you will put on your lifetime of using any of these brands. So that
Okay.
being said, on my soapbox,
Mm.
Vanity Cream is a really good brand that is great for the most sensitive skin.
Banana cream.
My
That's VANI, right?
VANI, yeah. My 13-year-old, however, has a bottle of Cetaphil lotion that she applies to her face and body. My 11-year-old has a bottle of CeraVe lotion that I have him apply when he gets out of the shower. And we all use Vaseline. For the most sensitive skin, we use Aquaphor and Vaseline because ointments tend to be more inert and better for like the most sensitive skin. And then if somebody has active breakouts on the face, I love, love, love Avène Cyclophyte and La Roche-Posay Cicaplast Balm. They're kind of in between your moisturizer and an ointment, but something that repairs the barrier, kind of heals
Okay.
the bridge between those two.
Okay. Someone asks, how do I get these products? I'm not sure which one specifically she's asking about, but she says, my doctors seem uneducated on all of this information. Does insurance cover any of these?
So somebody recently also commented about my doctor doesn't know anything. I felt dismissed. And I want to assure you, your dermatologist certainly knows what they're doing, but not every dermatologist is comfortable with all the things skincare because there's millions of products out there, literally. They know to tell you to put on retinoid and glycolic acid, but they're like, well, should you use the prequel glycolic or the ordinary? I don't know. And if it's somebody who doesn't do this, like doesn't use it themselves, they're going to be hesitant to recommend something in fear that you'll have a bad reaction. So
Right.
just because your doctor doesn't know doesn't mean they or just because it appears that your doctor doesn't know, doesn't mean they really don't know. They're just not comfortable. Like
Hmm.
we're medical field where dermatology is turned into something very cosmetic and skincare out there. Really deep down, we treat complex rashes and melanomas and skin cancers and things like that. It's just some of us happen to have interest in this. So don't put your doctor down. They're just not comfortable in that field. They know the general things, they're just not into all things skincare. Some of the things I talked about are prescriptions, some are not. Um, so, to answer this question, I guess I would say just go on my YouTube channel, type in that topic that you just heard that you're curious about. If I talked about the product, the links are below. Those are commission links to help me pay my YouTube person to help me edit videos because I don't have 10 hours a day to do it myself. And it still doesn't even support itself. YouTube doesn't, I fund it. So full
Uh,
disclosure there. And
okay.
if I say it's a prescription, then you have to see your dermatologist. So it just depends which product you're talking about, where to get it.
Okay. I got some questions in from community members. I see another question here, and then I'm going to turn to these other questions I got in. This person asks if you would talk about chin hair.
Yeah, if we could zoom in on mine. Listen, we all have it. Some of us are more so on a hairy side. I had it when I was 15, so you don't have to hit 40s, but by 40, most women do have some sort of chin hair. And what happens is we go back to that estrogen progesterone balance. So when you start losing estrogen, your body has more of like that male-like hormone. So we start thinning up here and we start getting hair down here. Bad combo. Spironolactone does fantastic job at reversing that. So spironolactone, we talked about it for hormonal cystic acne, also can help at higher dose minimize the hair loss for women up here and minimize the hair growth on the chin. So it's a really great, though, prescription medication. Laser hair removal does really, really great. I've had it many times. You name the body part, it's been lasered. The hair has to be dark. So the second hair turns gray, it just does not work.
It's not responsive to laser treatment, gray hair?
Correct. Laser targets pigment in the hair, so the hair has to be pigmented and the follicle has to be there, meaning you want to shave your chin hair, you don't want to pluck it 2 weeks before your laser appointment. Now, that being said, chin hairs, upper lip hairs, things like that are very hormonal. So if you're somebody who did that in your 30s, like I did, and then you hit mid 40s, you might need to do touch-ups. It's not permanent laser hair removal. It permanently decreases the thickness and the amount of hair you have. It doesn't take you back to, not a single hair when you were a baby, but it just kind of minimizes it. And if you go on my YouTube and you just Google chin hairs and my name, I did a video on this recently where I discuss all these things. Studies show that people forget 90% of what doctors say in the office. So I make videos on everything that's a popular in clinic topic.
Yeah, you really do. Everybody follow Dr. Brown, subscribe to her YouTube channel. Sort of continuing this hair issue, from a community member, I was asked to ask you, why does my hair suddenly feel thinner and drier? Is that hormones, aging, or both?
Both in diet. Okay. So I get compliments on my hair a lot. And let me tell you something. 90% of hair is genetic. So if you've always had thin hair, you do it's what God gave you. It's what you got, work with it. But even people with thick hair, like I am very conscious my hair is already thinning out, and that is definitely hormonal. It is thinning out up here. It is the parts getting wider. This is very common in your 40s. It's called androgenetic alopecia. So genetic kicks in. Women typically don't go bald. So if you're looking at your moms and grandmas, they just kind of thin out. We get very creative at fluffing it, moving the part. We're all doing it. Look at this is what we're doing. We're all doing it, ladies.
Right.
So you don't really see that, but your grandma probably noticed it. Your mom probably noticed it. And when you start noticing it, it's first thing is the part gets wider. Second thing for me, it's like right here when the sun is hitting just right, like you can see the scalp. And
Yes, yes, I
and then
know.
suddenly that part just got moved and we're doing one of these. Yep.
Exactly.
Uh-huh.
So,
And then I'm very short, but there's this one bathroom at work. Man, the light hits just right. And this white spot right here really shows up.
it's
So
so
that's
refreshing to hear from a doctor who's going through the same things we are. Can I just say?
yeah, and this is somebody who like hair looks good on camera. Like
Yeah.
when there's no sun now. When the sun hits it, it looks really shiny, but it looks good. Everyone thinks there's a lot of it. I am very conscious of it. Like it bothers me. So that's genetic stress. Let me tell you. I
Mm,
decided I was going to lose some weight in January. I was going to lose 5 pounds. Apparently, I took it too far. Lost 10. The hair was coming out.
yeah.
I thought I was going to go bald. So all these GLP-1s now, any diet, any stress, like any stress, you move, you get fired, like that coach Virginia Tech last weekend.
Yes.
Your hair, and that's 3 months later. So if you are just thinning out here and here, it's probably hormonal. Okay. If you're washing your hair and it's like chunks of it coming out and you feel like you're going to go bald, that is probably telogen effluvium, which is hair loss due to sudden onset of like a stressful event. And sometimes that's a physical event like deliveries, illnesses, weight loss. Other times it's a mental stressor like school or job or moving or something like that. Those typically go away, but I always recommend checking vitamin D. It's something that's really important to make sure that vitamin D is optimal. It's good for so many things. And then, watch your diet. Like I say, I've never been popular in my life. I've always been a nerd, but I've never been trendier than now. I eat cottage cheese, protein, and I walk with a weighted vest. So, eat that protein, walk with a weighted vest, get that strength training to keep your bones healthy because you're losing estrogen. Those are the things to keep your hair healthy. Your body's healthy, you're sleeping, your hair is going to be healthy, and your scalp needs to be healthy. But the thinning and the weighted, the stress that comes from weight loss and things like that, those things probably need to be addressed.
Okay. Okay. The best way to handle sagging skin around the jawline and neck.
Short answer, see a plastic surgeon.
Yeah, I was gonna say, are you about to
Listen,
say face lift, neck lift?
if patients come in and they're doing one of these, how do I make this better? And they're
Mhm.
pulling the jawline. If there's enough back there to pinch the skin by the ear when you're pulling your jaw back, that's a
Oh,
facelift. I mean, that
okay.
there's no, and they come in, can you do filler? Yeah, that's not gonna fix it. You're just gonna spend money and it's not gonna fix it. Like, it's really important to educate patients of what will happen. So
Right.
I've made video on this before many times actually, how to fix jowls, and I'll talk about things that will help over the counter. So that goes back to what we just talked about, your retinol. The sooner you start, the better. Exercise. Actually, exercise is really important. Strength training can and will build collagen. So 30 minutes, 3 times a week of moderate exercise. And that's my weighted vest. Like, you don't have to break a sweat, lift something heavy, break your back. Like, just do something that makes you happy, but that has some resistance training. And then oral collagen supplementation. And that's all in addition to your sunscreen, your retinol, your vitamin C, your peptides. All those things will help. But if you really look in a mirror and you pull back, that, like, I don't have a magic.
Right. That's a structural change. You have
Right.
to.
And we do have in-office procedures like microneedling, radiofrequency microneedling, fracs, and all those things will help tighten some, but not to that degree.
Okay.
Not to that degree.
Okay. Um, Someone asks, my hands are aging faster than my face. What's the best way to care for them? And do cuticles and nails change with hormones too?
100%. And for those of you with teens, if you can get them to put that sunscreen on their hands too, not just neck. Hands is one of those things that we really notice. One of the things I said I learned from my patients, put your sunscreen, your retinol on your neck, your hands and your knees and your upper arms. Those are the areas that age really easy. The easiest thing for hands is literally just put your sunscreen on there and do like your entire skincare routine. The nighttime skincare routine is actually not that bad. Everything I do on my face, I end up putting on my hands. The morning gets really tough. I mean, I've tried vitamin C and sunscreen. I get to work. By the time I put on a pair of gloves, it's sticky. They're not
Yeah.
going on, and I've already washed my hands. So the morning's really tough. One thing that's really easy, okay, this is the easiest thing you can do, is buy yourself a pair of SPF gloves and just keep them in the car. I
Mhm.
have ones from Coolie Bar. You don't have to get that brand. Amazon's fine. They even have little grippies on your palms to grip the steering wheel, and they cover your hands because when you're driving, you're getting UVA that's aging the skin. So the sooner you start prevention, the less you'll have to do later to reverse that damage. Um, so all your nighttime face skincare routines should go on your hands. And then in-office lasers actually do really well. I just did a CO2 laser on hands the other day because she has family photos coming up in 6 weeks. And she said last year they did one that was black and white. All the spots popped up. I'm like,
Oh,
well, you'd think they would Photoshop that out. But yeah, I'm happy to laser. So we did it. And some of them can be removed, but it's not going to be one and done. She'll need 2, 3 treatments to get them to lighten. And then she already got her gloves and everything. Like, she's doing retinol gloves and we're doing lightening agents. So do your face skincare on your hands, get those SPF gloves like yesterday.
a question that came into the chat about M4 and its delivery system. Her concern is that it'll sit on the surface of the skin and the actives don't penetrate to do their job.
So okay, so the serum, and I'm going to talk about the cream there because the cream's a little bit thicker, so you worry about that. You want to apply your actives underneath the M4 at night. So what have I applied under it? Like niacinamide, tranexamic acid, azelaic acid. Do you have any irigyrilline? Because those are serums. They're in a dropper. They come out like runny. Okay, your M4 is like, this is which one? This is the peptide. Your M4 is like a cream. So when you get it out, it's thicker cream. So you want to put that on top of your serums. Now, the one thing that I think goes well on top of the M4 is your tretinoin cream. So if you
Okay.
have a tretinoin cream, because I have that as a prescription, it's actually a little bit thicker than the M4 cream. I don't like mixing them together. I just feel like you get hot spots of one or the other. I like to know that I got the full pump of my M4 on my face. So I have not found that tretinoin did not penetrate through the M4 cream at all personally. And I've used it for a couple months. And the active serums that I have been underneath my M4. And in the morning, I apply my vitamin C, and then I'll do my eye cream, my M4 eye cream. I have like 5 eye creams, don't judge. I'm like an eye cream snob. But then my M4 with the peptide serum goes on in the morning. I put that on top of vitamin C.
Okay.
So I guess it depends how you layer them. Like you're not going to put serum on top of either of those two. Yeah.
Right. Okay. Thank you.
Mhm.
Someone asks also if you might have a recommended product for eyebrow loss. This is another thing that we see a lot. Oh, that looks like a yes, I do.
That's 100% yes. And it's a
Okay, I'm hearing.
minoxidil, hands down, hands down.
Really?
So yes. So I don't love, you think brows, people think lashes. The lash serum can go up there 100%. And I use Sweet Beauty and another one that's not on the market yet that's coming soon. So I have a couple of eyebrow eyelash serums that are prostaglandin free. Latisse. Okay, Latisse is a brand name prescription for eyelash growth. They use it in patients with glaucoma. Notice they have long lashes. They're like, boom, let's just make this. Allergan got patent, whatever. They have Latisse now. It's also generic. But that has prostaglandins, which can irritate your skin. Happened to me many times. I tried so many times, couldn't do it. It can cause hyperpigmentation or darkening of your lash line, and it can potentially cause periorbital fat loss, which means where your eyes like sink in. They already sink in when you get older. So if they sink in prematurely, you like age. So I am personally terrified of using Latisse, and I've tried a couple times before, and it was just too sensitive. But if you have a brow eyelash serum, you can use it on your brow. That being said, minoxidil, 5%, the one that says men's, just trust me, we're paying extra for the women's. They take the same thing, put it in a pink can and call it women's and upcharge. It's the same thing, and just use it once a day. Foam tends to be less irritating. So foam I'll apply on I have a old concealer brush and I'll just put it on there. If you have a solution, you can put on a Q-tip. If you just go on my YouTube channel and you just type in eyebrows and my name, it will come up. I've put minoxidil foam, minoxidil solution on my eyebrows many times. Last year I did this. If you look through last year's videos, I had some fat eyebrows and then I decided I liked them thin again. I don't know. So I stopped doing it.
Amazing.
Yeah. And now
Right.
there's a bald spot in the left one. So I'm back on it. I don't know what I did. I think it's
This is
stress.
a great tip. These are so great. Thank you so much for that.
Yeah.
Here's another question that I personally find very need to know. Laugh lines around my mouth. So there's these, right? Not talking about those. The ones just under this is what this person said, the ones just under the corner of my lip. So like here, I'm not going to pretend I'm okay with some signs of aging, she says. This really bothers me. Anything non-invasive I can try. Will M4 help here as well?
Oh, the non-invasive. You have to say that word.
Give us the whole thing. Invasive,
Listen,
invasive, all of it.
so do all the things. Do your sunscreen, your vitamin C in the morning, at nighttime, retinol and M4 100% because you want to hydrate and you want to stimulate collagen production. But I know exactly what you're talking about. We're all asymmetrical. And just on my left side, I have line that goes all the way down to here and then right here. Like when I smile, it's a crease. It's not even like a line, it's more of like a crease. If you put makeup on, it just creases. So you need what's happening is it's just when you smile and move, that line folds constantly, and it just kind of stays there because skin has thinned out. Every time it folds, it just etches in a little bit more. So you're trying to thicken the skin back out. So that is your M4 and your retinol, glycolic and all that to help stimulate collagen production, exfoliating acids to get rid of the top layer of the skin cells. So there's not as much to crease.
Okay.
But microneedling. Okay, let's talk about in office. Microneedling does so well, especially if you do it with PRP or platelet-rich plasma. I've had that done many times, and I will do it again in a heartbeat. And if you take a really fine filler and you just go into just put little droplets into that, we're not talking about well, it's filler, but if you just take a super fine filler, so if it's Juvederm, maybe Volbella, or if it's Restylane, maybe refined or defined, or I personally have RHA, will be RHA Redensity, and you just put little droplets in there. A filler's made out of hyaluronic acid. You're literally delivering those hyaluronic acid. Do not do this at home. We have somebody who did with complications. This is in office to be performed by a physician. And then you literally just take that line and you swell it. We did this on mine. One of my other dogs did it probably 3 years ago. And it's just now showing up again. And it was so satisfying. Like, I
Wow.
really have no words for how much it meant to me. And he could barely see the line, and that's fine. Men don't see things the way we do. But
Dr. Brown, about microneedling, I've heard not great things for darker skin. Is this so with microneedling, or is it safe for all skin types and colors now?
safe for all skin types and colors. It just really depends on what your settings are and what you're treating. So
Okay.
I have patients with skin type 6 doing microneedling. There's no issue whatsoever. You just have to make sure, proper numbing, proper skincare afterwards, sunscreen 100%, and the settings have to be, and I'm not talking about radio frequency microneedling. I'm just talking about plain microneedling. The radio frequency microneedling are like Secret, Morpheus, like there's a little bit spicier, a little bit more risk of hyperpigmentation. The plain microneedling, while there are risks of hyperpigmentation, they're higher than in lighter skin types. It's fine to do. We've done it many times in the office, no problems.
Great. Aging. Someone asks, my pores are bigger, she says. I swear as I'm aging, my pores are bigger. Anything I can do?
That can happen. So what's happening is collagen, elastin are decreasing, and all those things that have been on your skin forever are suddenly a little bit larger, more noticeable. Plus, we all got that magnifying mirror, so we're seeing things we're not supposed to see.
We do,
So,
because our vision is getting worse and we need it.
and I'm not anti, I have one too, but you should just know that you should get a regular mirror, put it about conversation distance away. And if it doesn't bother you from there, then you shouldn't obsess with it. Like, we really need to be careful about what we're obsessing over, because women are treating things that like are normal. Okay. That being said, pores do get larger. So things you can do, salicylic acid, whether you do it in a cleanser or a toner, either one's fine. Have a couple of salicylic cleansers in the shower. It helps kind of minimize the oil in the pores. But if you have dry skin, that's a tough one because salicylic can really dry it out. If your skin's super oily, like salicylic acid toner is very beneficial. You can even leave it on overnight. It will help. It doesn't shrink pores. Okay. There are products over the counter that say shrinks pores. If you read closely, it just has salicylic acid in it. It's just marketing. So any product with salicylic acid will help. Tretinoin will 100% help, and M4 will help because it'll help hydrate and stimulate collagen production. So combination of all three is going to be very helpful. Retinoids, your M4, and sal acid.
Dr. Brown, you just said something that makes me think of the beginning of our conversation. You said this, and we're getting to the close of our hour. I didn't anticipate sort of calling this out, but one of the things that I so appreciate about you is that you sort of meet us women where we are, and in terms of like, don't obsess, the country I was born and raised in, we weren't all obsessed about aging. There's this fine line that you walk very successfully, I think, where you sort of say we can celebrate our aging selves and look like show up as the best that we are. And I really appreciate that. With that in mind, any sort of final words you would want to leave perimenopausal women with, menopausal women with? I think you've laid out really well sort of the most important key product takeaways. But I don't know, I'm saying a lot of things at once, but I really appreciate that your candor and your sort of kindness towards women, amplifying the best of ourselves, using great products, some of them expensive, some of them not so much. Anything finally I've missed?
Yeah, I guess it's not like, what would I tell my younger self? It's like, what would I tell myself nowadays when I have those moments when you spiral and it's like, you're not crazy. Your body's just changing. It's just that you're mature enough now, so you're more aware of it. You're not a teenager and it's changing. You're on the other spectrum of it. And all these things are normal and we're all going through it. And it just depends on how bad it bothers you. And it's sad that nowadays there's so much of perfection and women have to look a certain way because people haven't lived to this age. Like, lifespan is longer and
Right.
women are expected to look a certain way or they want to look a certain way. And I wish we put a little less pressure on ourselves. So I think it's important to have a reality check with yourself from time to time and to understand, what are you doing, why you're doing it, what's your purpose. Like, I'm in the cosmetic field, but I've told myself, and my husband's going to tell me if I get out of control, that I don't want to look weird. I just want to look like myself. Like I'm okay with wrinkles. I just don't want to look weird. Don't do things you don't need to be doing. Like I do a bunch of fillers, but that with patients, and that's fine, but you want to be conservative. Just really, your magnifying mirror is not your friend. You're seeing things that are normal. So not to say that those aren't real concerns, but just to kind of look at the big picture here.
Yeah. So appreciated. Dr. Brown, I appreciate the way you've broken this all down, clear, encouraging, practical for every one of us listening. For those of you watching quickly, certainly I know you're walking away with a better understanding of what's really happening to your skin, how to care for it in a way that feels supportive, actionable, and realistic. Because it is Perimenopause Awareness Month, I'll remind you that some of these changes begin before we realize we're in perimenopause. So to Dr. Brown's frequent points, taking care of your skin proactively makes a huge difference. And we certainly are here to support you through every stage. For women curious about estriol and skincare, M4 is your friend. Take advantage of today's code Brown20 over on the Alloy website. Thank you so much again, Dr. Brown. Just an absolute pleasure sharing your expertise, your kindness, your thoughtfulness, your education. Thank you for being here and joining the Alloy community. And thank you to everyone who came today.
Thanks so much for having me, Rachel. I really appreciate it. This was amazing. I've loved my products. I've loved sharing my knowledge. And if anyone has other questions, find me on any platform, drop a question. I do have perimenopause files, I forgot to mention, like series where I've shared my story and what's happened to me. So go on any of those videos, comment, and I'm happy to answer questions.
Oh, terrific. Thank you, Dr. Brown. Again,
Thank you so much.
Be well. Bye-bye.
Bye.